Joining us now is Dr. Eric Beck. He's from the Valley Center for Nerve Studies and Rehabilitation. Today, our topic is carpal tunnel syndrome. And I remember growing up, you always, your teacher ended up with something like that, and we all thought it was from writing on the chalkboard. So tell us about the treatment for carpal tunnel today.
Well, Christy, carpal tunnel syndrome is probably one of the most common conditions that I diagnose in my practice. And as you may know, carpal tunnel syndrome usually involves pain, numbness, and weakness, usually in the thumb, index finger, and ring finger. Usually after I diagnose the carpal tunnel syndrome, people ask me, what can I do to avoid surgery?
Because a lot of people, would like to, if they could, avoid surgery. So what are some of the treatments, non-surgical?
Well, in mild to moderate cases, I usually recommend treatments such as braces, exercises, anti-inflammatories, and sometimes steroid injections.
Okay, so what if those non-surgical treatments don't work?
Well, if the condition isn't getting better or if it's getting worse, I usually recommend people go see a surgeon. For example, if you can't get a pitcher of iced tea out of your refrigerator or lift a pan of cornbread out of the oven, then you really need to go see a doctor. And carpal tunnel surgery is very effective with a minimal recovery time.
Okay, so what can people do to maybe prevent something like this? Maybe, they think, I think I might be at risk for something like that.
Well, you may not be able to prevent it, but the key is to recognize it early. Okay. And that's really the key, is to diagnose it. Once we know what's going on, if you do have carpal tunnel syndrome, then we can address it by treatment.
Okay, so who is most at risk? Because I know I type all day. Is that something that would put you at risk for that? Or
that can. Women tend to have a higher percentage of carpal tunnel syndrome. Sometimes people do repetitive activities. And also, as we get older, we have a higher incidence of carpal tunnel syndrome.
Okay. So early detection is the key, and if so, you can get in touch with Dr. Beck. Here's his phone number if you want to get in touch with him, if you know that you might have some carpal tunnel issues that you want him to take a look at. It's 382-1603. And as always, we'd like to thank our friends at Open MRI for helping us with today's Way to Good Health interview. Thanks so much for coming up.
Thank you.
Joining me now for our Way to Good Health segment is Dr. Eric Beck, and he is from the Valley Center for Nerve Studies and Rehabilitation. And today's topic is about stretching. Thank you for joining us.
Hi, Laura Beth.
So tell me about stretching.
Well, stretching is a really controversial subject in running these days, and we have the Huntsville Hospital Autumn Chase Run coming up September 24th, so that'd be a great topic to discuss today.
And that's right, they're coming up Monday to start talking about this run, so a lot of people are going to participate. Now, should people stretch before they run? We've always been kind of told that.
Well, and that's what I always learned. When I was in school, we always stretched before we went and exercised or before a run, so the idea was that this would help us prevent injuries and soreness after we exercised.
And does stretching really prevent injuries?
Probably not. Recent research shows that it doesn't really help with injuries, and some people even say it may make them worse.
And how is that?
Well, the problem is you stretch on an inflexible muscle. The muscle's cold and it's tight, and then when you stretch on it, it can really aggravate things.
Okay, so what should we do instead?
Well, the main thing is warm up before you exercise. And I recommend people usually walk or lightly jog 5 to 10 minutes before they exercise. And then if you want to stretch, do it after you do your run.
So what are we doing by doing that? How long, is it taking to warm up a muscle? Because some people feel better after stretching a little bit.
They do, and again, the main thing, stretching's great. I really recommend it, but make sure your tissues are warm before you stretch. Okay,
especially in cold months, we're talking about getting out and running, or early morning running, anything like that.
Absolutely. So make sure your tissues are good and warm. And when you stretch, hold it about 15 to 30 seconds, and above all, don't bounce when you stretch, because you can really hurt yourself.
Okay, and bouncing is that more leg injuries if you do something like that?
Yep, you'll pull a hamstring or Achilles tendon really easily if you do that.
All right. Any other tips you want to pass on?
Well, the main thing, warm up slowly, do your exercise, and then do your stretching as part of your cool-down routine.
And how long should we hold a stretch or anything like that?
The American Academy of Orthopedic Surgery recommends about 15 to 30 seconds at a time.
Okay. All right. So give it some time. Don't be doing the quick stretching.
Absolutely. Slow and easy.
All right. Well, if you would like to get in touch with Dr. Beck, you can reach him at his office at 382-1603, and that is the Valley Center for Nerve Studies and Rehabilitation. And we would also like to thank our friends at Open MRI for helping us set up today's interview. Thank you, Dr. Beck.
Thanks a lot.